Malaysia's public healthcare system is buckling under pressure.
The public system is basically overburdened, and there are areas where there's some sort of crisis happening at the moment.
A lot of on-call where we have to work up to 33-hour stretch.
Sepatutnya kena bagi perhatian juga sebab saya dalam kesakitan, mata saya masih ada berdarahan dekat dalam. Dia kata, tak, lepas pukul 9 baru kita akan accept emergency case.
Falling recruitment, an exodus of doctors and a growing patient load have left medical professionals under immense strain.
At one time, there used to be an intake of around 5,000-6,000 doctors, 8-9 years ago, and now it's dropped to around 3,000.
What's behind the staffing crisis in Malaysia's public hospitals? "51-year-old Hasnaulia Abdul Hamid regarded herself as an energetic and active person, but the single mum is now grappling with her mobility. Her health struggles began nearly a decade ago after a motorcycle accident sent her tumbling into a drain. 3 years ago, she started experiencing muscle weakness, making everyday tasks like lifting objects increasingly difficult.
Kebas, kita tak boleh pegang macam, kalau saya kan kedai, so bila kita nak pegang tu dia memang tak kuat. Kita macam gagah-gagah lah sebenarnya.
One day, she suddenly lost control of her legs and collapsed at a mall.
Oh, jatuh dekat mall. Saya macam terfikirlah. Arwah mak saya meninggal sebab brain tumor. So saya takut macam saya ada kanser ke. Macam itulah.
That's when she decided to go to a government hospital.
Sampai pukul 7, saya datang. Saya terus masuk, ketuk, masuk terus. Saya hari tu dekat pukul 9. Baru dapat. Jumpa 5 minit je. Cakap tak ada crack, tak ada apa, balik. You bayanglah, saya daripada pukul 8 pagi sampai dekat pukul 9, itulah layanan yang saya dapat. Dan masa tu juga ada satu warga Johor, memang dia dah mengamuk dekat tu. Sampai ada dia orang nak panggil polis lah, konon-konon. Kenapa jadi lambat? Bilik rawatan banyak, 10 ada. Kenapa hanya 2 atau 3 je yang ada doktor?
A day after visiting the public hospital, she sought help from a specialist clinic, hoping to find a clearer diagnosis. However, when that too failed to provide a definitive explanation for her condition, she turned to a government clinic. It was there that she finally received the diagnosis, a thyroid disorder, a condition which was affecting her nerves.
Bertahun-tahun saya pergi klinik hospital. Tapi saya tak ada jawapan benda tu. Alhamdulillah bila saya bertukar pergi ke klinik kesihatan, saya dah dapat jawapan tu.
Hasnaulia's experience highlights a much deeper issue within Malaysia's healthcare system, the growing shortage of doctors in public hospitals. In 2019, there were 6,134 housemen employed by the Ministry of Health. In 2023, the number had fallen to 3,271. It's a 50% drop within just a few years.
I think at one time there used to be an intake of around 5,000-6,000, 8-9 years ago, and now it's dropped to around 3,000. So, and as the country opens up new facilities, infrastructure, hospitals, clinics and all that, the number that is joining in is not enough.
To be clear, Malaysia has a healthy number of doctors. According to the 2023 data, the country's doctor-to-population ratio remains consistent with international standards. It stood at 2.4 doctors per 1,000 people in Malaysia, the second highest in Southeast Asia after Singapore. But the total number does not tell the full story.
So if you take it as a whole, by numbers, you can see that this ratio is considered quite sufficient. But most of the doctors are concentrated into urban centres or states which are considered quite wealthy. This would be things like Johor, Penang, and also Wilayah Persekutuan or Putrajaya itself. So these are the states which has so-called sufficient doctors. But if you look at certain states such as in Borneo, Sabah, Sarawak, Pahang, Kelantan, and you can see there's a huge discrepancy of doctors to population ratio.
The shortage is especially acute for specialist doctors in public hospitals. According to the Malaysian Medical Association, Malaysia's population to specialist ratio is approximately 4 doctors for every 10,000 people. It's significantly lower than the OECD's recommended ratio of 14.3 specialists to 10,000 people.
Even though the health ministry, the government hospitals caters to a big chunk of the population, only a small percentage of doctors, I was told it's around 15% of the doctors in the public sector are specialists, which is low.
Dr. John Chan is a cardiothoracic surgeon at a private hospital in Kuala Lumpur. He specialises in surgical procedures related to the heart, lungs and other organs within the chest cavity. As for his counterparts in public hospitals, there are only 14 cardiothoracic surgeons nationwide.
There is a long waiting list for treatment of heart diseases in many public hospitals, but the urgent cases are prioritized, so the very sick patients who do need urgent care are treated earlier. So in that way, I think this situation is minimized, but of course there will be patients who do not make it while waiting for heart surgery.
There is also a shortage of oncologists. Every year, about 50,000 new cancer cases are diagnosed in Malaysia. However, there are only 120 oncologists in both public and private hospitals.
Most of the patients that come into into our concern will be the later stage, which is already stage 3, stage 3B, stage 4 of breast cancer. Now, what happens is that they might come earlier, but because their results come back late or they are not able to see the doctor, the disease has progressed into a later stage. Now, this creates a lot of problems because once you have a later stage, basically, your quality of life, your mortality risk actually goes up.
The doctor shortage is a problem the government is trying to solve. Last year, Parliament passed the Medical Amendment Bill to boost the number of specialists. Young Shafura Othman is a member of the Special Select Committee on Health. It reviews the performance and progress of the Health Ministry. She's also a member of Parliament from the Democratic Action Party, or the DAP, a key component party in the ruling coalition.
Kami lihat waktu menunggu dan juga ruang yang dihadapi yang tidak mencukupi, wad yang penuh dengan pesakit dan sehingga ada yang pesakit perlu menunggu untuk dimasukkan ke dalam wad dan sebagainya. Dan ini ditambah pula dengan faktor apabila kita kekurangan doktor untuk memberikan perkhidmatan yang terbaik. Kita dah cukup beri yang terbaik sekalipun, tetapi kerana kalau kita lihat negara hari ini memang penyakit-penyakit yang tak berjangkit semakin bertambah.
And one of these is diabetes. Malaysia has one of the highest cases of diabetes in Asia and the West Pacific region. Approximately 1 in 5 Malaysians is affected. 47-year-old radio producer Azmir Sharifuddin has been living with diabetes since his 20s. Soon after he entered his 40s, he was diagnosed with high blood pressure. Over time, his vision started to deteriorate due to a combination of both diabetes and uncontrolled hypertension. As a result, he was left with only 20% vision in his left eye and 50% in his right.
For my work, I have to use the computer to do write-ups, and then also I have to produce programs, which means that I have to talk to people. And sometimes it's just, I can't exactly see what they're showing me.
In 2015, Azmir sought treatment at a government hospital for bleeding in his eyes, a condition known as diabetic retinopathy. And that's when high sugar levels damage the blood vessels in the retina, leading to bleeding. But the scheduled eye surgery took almost a year to materialize.
I heard that there's not that many specialists available. So that's why we have to wait a long time. The cost is going to be quite expensive. So at that time, I don't think I have the resources to go for a private.
Today, most patients prefer public hospitals over private hospitals and clinics. This means that in 2022, the number of patient visits to government hospitals and clinics reached approximately 77 million. It's a staggering 4.5-fold increase since 2008. The majority of patients go to government hospitals as they are cheaper compared to private facilities.
Semestinya rakyat hari ini akan memilih servis yang memberikan mengurangkan kos kepada mereka, membayar nilai hanya RM1 ataupun RM5 ataupun RM10 berbanding dengan swasta, sama ada mereka perlu ada insurans sendiri, mereka perlu bayar amount yang besar dan sebagainya. Jadi dengan faktor ekonomi hari ini, rakyat akan memilih hospital kerajaan sebagai keutamaan.
Kalau pergi hospital swasta, you tahulah sekali pergi daftar je dah 300-400 dah tentu. Kalau sini RM1 je. Mana you nak pergi?
So when we talk about crisis, we are talking more of the public areas. So these public areas, we do not have enough manpower in a way that would be mostly doctors, but also nurses and so forth.
On the other side of the coin, there is a shortage of nurses in public hospitals as well. As of 2023, there were almost 7,000 unfilled nursing positions in Malaysia's public healthcare sector. If the trend continues, the Ministry of Health says that by 2030, the shortfall could reach almost 60% of the required nursing workforce. But what has really contributed to the shortage of medical professionals in Malaysia's public hospitals, especially when there was a surplus just a decade ago? It is 1990. Malaysia then had only 3 medical schools: the Faculty of Medicine at the University of Malaya, the Faculty of Medicine and Health Sciences at University Kebangsaan Malaysia, and the School of Medical Sciences at University Science Malaysia. Collectively, these institutions produced around 300 graduates every year. Today, the country is home to over 30 medical schools, producing thousands of would-be doctors. The expansion was driven by the government's ambition to achieve a doctor-to-population ratio of 1 to 400, similar to that of the developed nations. In 1990, the doctor-population ratio was 1 to 2,560. But in the aggressive pursuit of this target, there was now a surplus of doctors in the country.
In the mid-2010s, there were too many medical graduates that were being produced, but there was not a corresponding increment in positions available where these doctors are able to be put in.
In Malaysia, before a graduate can be registered as a medical practitioner, they must complete a minimum 1-year housemanship training.
When the number of doctors are joining in, graduating became very big. Housemanship can only be, at the time was given based on posts available. When the posts available are not enough, then the waiting period for those waiting for the post becomes longer. So at that time, there were some who were waiting for 6 months. There were even doctors waiting for 1 year to enter housemanship.
Well, I think it leads back to the income of the population. As you know, Malaysia comes from so-called an upper middle income country where our GDP is not as high as maybe Singapore or even the OECD countries. So when that comes into a play, we cannot make a lot of posts for doctors.
By the 2010s, the government, under then Prime Minister Najib Razak, was compelled to act. In 2011, the Ministry of Higher Education implemented a 5-year moratorium on new medical programs to regulate the number of graduates. It was extended for another 5 years in 2016. During this period, the establishment of new medical colleges and medical degree programs were halted. Existing medical schools were also not allowed to increase their intake of students. The quota was set at 1,550 students annually. Despite the moratorium, the number of medical graduates continued to rise. From 4,490 medical graduates in 2015 to over 6,000 in 2017.
Those who have enrolled into medical school before 2011 has already been locked in. So this means that the amount that has been of graduates that we will produce has already been locked in, which is why there was a 5-year lag. And in 2016 or 2017, when the pre-moratorium medical students graduate, you see a peak in the number of graduates in Malaysia, which went up to about 5,000 to 6,000 around the late 2010s.
The effect of the moratorium was seen after 2017. Accounting for just local universities, the enrolment saw a decline from 3,902 in 2017 to 2,667 in 2021. It's a drop of over 31%. But part of the drop was caused by the changing job security for doctors. To absorb the oversupply, hospitals began hiring doctors on contract instead of offering them a permanent position.
That means they do not have a permanent post. So that puts a hamper on the progress of these doctors, because most of these would actually, they want to go into specialty training. So contract doctors, that is almost, non-existent, because your contract, you can actually be removed in just 2 years after that.
Dr. Muhammad graduated from a local university in 2016. He has asked to remain anonymous. Dr. Muhammad had to wait a year before being offered a position to do his housemanship, where he would earn around 3,000 ringgit a month. After completing his housemanship, he was hired on contract to work in public hospitals.
We suddenly feel that there's a lack of future for us. So anytime they can terminate us. And then there's a lack of career progression. We are stuck in the same grade. So when you become a house officer, you are grade 41. Then after 3 years, they offer us grade 43, but we'll be stuck in it until our contract ends. Unless we become permanent, then only we can increase to our grade to grade 48 and so on. So if your grade is lower, your yearly increment will also be lower. So there's a disparity in that as well.
So those days, at the beginning, contract doctors were not allowed to go to specialize. This kept their professional growth.
If you're on a contract, car loan, house loan, you can't take. Even a bank loan also, I think you can't take, because nobody will offer you when you have no certainty of a job. So in that sense, it does have an effect on the doctors. It does. And you don't know whether your contract, what's going to happen to your contract after this.
As for Dr. Muhammad, he ended up on contract for 7 years.
All of us, most of the doctors, even in the medical school itself, we already have an ambition. You want to be this specialist, you want to be surgeon, you want to be a psychiatrist or physician. So, but just because we are contract, we are unable to achieve that dream. So I think it's very much unfair to the doctors.
And contract or permanent, doctors in Malaysia work long hours. The Malaysian Medical Association said doctors can clock as many as 84 hours a week.
Recently in Sedang cardiology department, they have about 700-800 patients coming just for 1 day. So the numbers of doctors are only 10 to 15, but they have to look into 700 patients. Imagine them coming early at 7 a.m. and going back at 8 p.m. and this is like almost a daily routine for them. So this is one of the stressful situations. And also because of lack of doctors nowadays, a lot of on-call where we have to work stretch up to 33-hour stretch. So we have to do it about 8 to 10 times per month. And sometimes even in Sabah, Sarawak, where the doctor shortage is even worse, they go up to 13, 14 times per month. It's like every day they are working.
We need to ensure that we have an adequate number of junior doctors, house officers joining in the service, because if the number keeps dropping, the pressure will remain or will go onto those who are remaining in the system, and that that pressure will have a vicious cycle effect that, those who can't take it will leave.
On July 26, 2021, contract doctors staged a walkout at over 20 government hospitals nationwide. They demanded permanent employment status, equal benefits, and opportunities for career advancement. Muhammad participated in the protest.
During the COVID, we felt very tired. It was a very stressful situation. So all of us, the contract doctors, we discuss and we finally feel that we need to take a drastic action for the government to listen to us, that we are not someone that they can kick here and kick there. And finally, July 26, 2021, we organized the nationwide protest, which brought a lot of attention from the ministers, from the government.
Then there is the issue of pay. For a grade UD43 doctor like Muhammad, the monthly pay scale ranges from 3,611 to 10,560 ringgit, around 850 to 2,490 US dollars per month.
For someone, let's say a parents, to send their kids to a medical school in Malaysia, it costs roughly about at least 500,000 ringgit. So that's 500,000, but you are still only being paid about 5,000 ringgit per month. So how many years that you have to work to recuperate back all those loans that you take? So maybe that's why even parents nowadays are no longer in last time mindset. They are very proud if their kids are doctors.
For all these reasons, some observers believe the medical profession in Malaysia no longer has the same prestige it once had.
Maybe because of what the doctors, or parents or students saw, that, all these issues are going on with the medical profession, the intake to medical colleges dropped.
Meanwhile, even those who have graduated may not stay in the job. A 2024 study by Human Resources for Health found that only 6 in 10 housemen plan to continue their careers with the Ministry of Health. Nur Zulaika Ahmad Lutfi is currently a medical student. The 20-year-old had contemplated leaving her course several times.
The studying part is already hard. And then after the studying comes the work, right? So the working already seems hard. And it's not a very short term of working or short term of studying. It's a long-term, lifelong thing. So I wonder most of the time if I can do that, if I can commit to all this hardships and all that. So yeah, I have thought about quitting, but then when I go to the wards and then I see house officers who are in the same age range as me, and then I see how they're still able to care and then be kind to people, and then that give me motivation that it is possible to pursue a career in this still.
But there are others who no longer share the same passion. Frustrated with the current state of affairs, many have simply packed their bags and left for greener pastures. Can Malaysia avoid a medical brain drain? Manisha often struggles to stay focused on her computer screen for more than an hour. Manisha has asked to remain anonymous. The 47-year-old's eyesight has deteriorated following an accident 2 years ago. She was knocked off her motorbike when a food delivery rider collided with her at a traffic light one morning. She was dragged across the road for around 20 metres.
Muka berdarah separuh. Maksud saya darah daripada dekat hidung saya dengan sebelah kiri dengan mata dekat sebelah sini. Muka saya ni ada calak sikit lah. Pergi jumpa dengan pakar dulu. Pakar mengata kena pergi hospital besar.
She arrived at the public hospital at 2:30 in the afternoon, but it was well into the night before she managed to see a doctor. At that time, the hospital only attended to what it deemed as non-emergency cases after 9 p.m. due to high patient load.
Lepas pukul 10 malam tu baru doktor kata nak buat buat CT scan muka. Lepas buat CT scan, baru dia orang kata bagi saya balik lah, tak admit saya. Dia orang bagi saya balik, appointment, jumpa balik dekat klinik. Yang dekat tangan-tangan luka tu yang dia pakai sikit plaster macam tu sajalah. Muka tak letak plaster. Sebab dia macam, luka dia bukan besar, bukan kecil lah. Tapi ada berdarah keluar. Mata saya tu, saya ni memang ada sakit sangat dengan mata. Dan tapi kata doktornya kena jumpa pakar dekat klinik.
It was only at the specialist a week later that Manisha discovered she had a facial fracture.
Sepatutnya kena bagi perhatian juga sebab saya dalam kesakitan, mata saya masih ada berdarahan dekat dalam. Masa tu saya bagi tahu dekat dia, ni memang pun saya ni macam ke emergency juga. Kenapa tak nak accept? Dia kata, tak, sekarang belum pukul 9 lagi. Lepas pukul 9 baru kita akan accept emergency case. Memang pun saya berkecewa dengan dia orang sebab tindakan mereka tak betul. Tak wajib buat begitu pada saya lah sebab saya dalam kesakitan.
The shortage of doctors at public hospitals has led to long waiting times for patients. On the flip side, it also means a heavier workload as doctors pull a double shift.
There was a survey that was done in 2024 that actually states that in only 5% of Malaysia's public healthcare system facilities have got adequate manpower. What this means is that in many healthcare facilities in the country, these doctors or these healthcare professionals may be facing extra higher amount of workload and causing them to be tired, burnt out, and overall have a lower morale.
Because it's a vicious cycle. So there's increasing in number of patients every day because of the rise in medical inflation. The folks cannot afford the private medical hospital, so they have to come to government. So there's a lot of patients nowadays in the government sectors, and the doctors are leaving. So once more patients, less doctors, more stress to the doctors, more doctors quit.
According to the Health Ministry, in 2022 alone, of the 1,696 medical officers who left the public service, 54% left for the private sector. Between 2019 and 2023, 6,417 permanent and contractual medical officers resigned from the service. This works out to an average of 3 doctors who quit daily. A total of 1,046 specialists left government service during the same period. Some who quit ventured overseas.
Most of the doctors that we churn out actually is either some of them are leaving towards better pay outside and things like that. We do have a problem of brain drain as well in Malaysia, but some of them are also leaving internally, meaning they are leaving the public sector but they are going into the private sectors.
Dr. Roland Victor has been a doctor for the last 17 years. He recalls the struggles during his 6 years in the public system.
There's 200 patients and then we seven or 8 of us, MOs, housemen together, we have to clear the whole traffic and wrap up the clinic by 4:30, 5 o'clock because we have to shut the clinic by 5. So then the compromisation of quality will come because we have to clear the traffic. This is what the biggest issue with healthcare at the moment is. Hello, good morning.
After leaving the public sector, he chose to stay in Malaysia, setting up a private practice in 2014.
Even at the time of graduation, like people have asked me, would you leave to the Gulf? Would you leave to Europe? I said, no, I want to go back and serve. I was adamant with that. And I'm back here. So I still have no regrets because I feel that there's a lot to contribute here.
Others, however, have packed their bags for overseas pastures. The World Bank estimates that Malaysia loses approximately 20% of its trained medical professionals annually since the late 1990s.
They just resign because they got options. Especially if their degrees are recognized, or some of them even sit for exams, they move on. They move to Singapore, as I said, UK, Ireland, Australia.
Consultant respiratory physician Dr. Syed Ajmal moved to the UK in 2016 after 4 years at a public hospital here in Malaysia. There he was paid £4,000 or about 23,000 ringgit per month. That's more than 5 times his last drawn salary before he left Malaysia. But for Dr. Ajmal, it wasn't just about money.
It was more of a longing for a sense of adventure. You know, if I knew if once you get married, you have kids, you know, that's it. You will probably work in Malaysia for the rest of your life, which is not a bad thing. But you wouldn't get that experience I've had, you know, working, living abroad, you know, gaining that experience you can from the UK that you might not have gotten here.
According to the Malaysian Medical Association, over 5,000 Malaysian doctors have left the country in the past decade. Many of them have moved to countries such as Australia, the United Kingdom and Singapore. In most markets, junior doctors overseas earn 2 to 3 times more than their counterparts in Malaysia. For senior doctors, the average monthly salary could be quadruple or more in other markets. For specialists and consultants, the disparity is even wider.
If you compare, you say compared to other countries, even compared to our neighbour Singapore, it's a pittance. I think, it's a very sensitive issue when we say it. It's just $9 plus an hour.
Dr. Muhammad too considered packing his medical bags and venturing overseas.
Yes, on and off. Sometimes when I see my friends who have migrated, they seem so happy overseas, they have a proper work-life balance. So sometimes I do feel I want to migrate, but I have to think about my family as well as the people here, because I'm actually was given a scholarship by the government to pursue my studies. So I have to serve that bond. So as a gratitude, because I'm using the people's money to study, so I still have to stay here. I mean, it's still my responsibility to serve the people here.
The government has implemented a 15% salary increase for all civil servants, including doctors. There's also been a slight increase in on-call allowance.
There's some increment, but it's not enough with the living cost nowadays. With the inflation and the living cost nowadays, I think especially if they are working in the cities, I think this is not sufficient, especially for a young doctors or a family of doctors, with young family that lives in the city. I think this is not sufficient.
The government has worked to attract the Malaysian diaspora back to the country. Talent Corp, an agency under the Ministry of Human Resources, manages a scheme called the Returning Expert Programme, or REP. Skilled Malaysians are encouraged to return through tax incentives and rebates. Dr. John Chan spent more than 2 decades studying and practicing in the UK, specialising in cardiothoracic surgery. He returned home after receiving an invitation from the Health Ministry.
When I came back here in 2012, I could really tell that I was making a difference. We did not have enough specialists to start with, but as we produce more specialists, then these new specialists will be able to train even more specialists. So the number of specialists will increase exponentially.
For Dr. Ajmal, he too returned to Malaysia after an 8-year stint in the UK. He came back after receiving an offer from Sunway Medical Centre in Selangor, a private hospital.
Sunway made it easy, Talent Corp made it very easy. It was always my intention to come back and work here. So this sort of opened up the window of opportunity for me, and they made it very easy. So I didn't have to quit my job there, come home and start looking for work.
But Malaysia will need more people like Drs. Chan and Ajmal. Since 2011, Talent Corp has approved almost 7,000 returnee applications. But of these, only 483, or 7%, are in healthcare.
From my own experience, when I see a lot of doctors who leave, it's not easy to come back. Once you set up roots with family and all that in other countries, not easy to come back. Not many come back.
Last year, the shortage of medical professionals was discussed in Parliament. What is the government doing to address the staffing shortage? And will it be in time to address the country's increasing healthcare burden? Malaysia is rapidly transitioning into an ageing society. 7.4% of its population are aged 65 and above, making Malaysia the fourth oldest country in ASEAN. This figure could rise to 14.5% by 2040. As its population ages, the demand for healthcare is also expected to rise, adding greater pressure to its already strained system.
In terms of obesity, there's a report that says almost over 53% of Malaysians are either overweight or obese. Diabetes itself, 1 in 5 Malaysians have got diabetes. And of course, the high blood pressure is about 30% of the population. With Malaysia reaching aging population status over the next decade, this certainly would be a threat that the government has to address.
The incidence of diabetes, cardiovascular diseases in Malaysia is increasing. But if you look at that in developed countries such as the United Kingdom or Singapore, is decreasing. So we are almost the opposite.
Dan ia sebenarnya berbalik kepada rakyat ataupun masyarakat yang bagaimana mereka dengan kehidupan lifestyle mereka, bagaimana mereka dengan faktor pemakanan mereka, dengan kehidupan sosial mereka dan sebagainya. Jadi faktor-faktor ini menyumbang kepada penyakit-penyakit yang tak berjangkit seperti kencing manis, obesiti dan sebagainya.
With increasing healthcare burden, there is urgency to recruit enough healthcare professionals. In April 2022, the government announced that it would absorb almost 13,000 contract doctors into permanent positions over a period of 3 years. In 2021, there were about 23,000 contract doctors in Malaysia. By 2025, the number is projected to rise to 30,000 this year.
Daripada lantikan doktor kontrak, kita telah tambah daripada contohnya 2024 ke 2025, 6,000 lantikan tetap telah dibuat. Maksudnya ada peningkatan di situ, ada penambahbaikan di situ.
In 2023 alone, nearly 4,300 contract doctors were made permanent, costing the government about 1.7 billion ringgit, or $385.8 million. Dr. Muhammad received his offer in 2022 after serving 7 years on contract. However, some of his peers missed out.
There was no proper criteria of who being offered and what's the requirement for someone to be offered a permanent post. So many of my friends, after 7 years as a contract medical officers, they had to leave the system. They were not being offered any more new contract.
Previously, it was unknown. But now the government is moving forward. I think the contract doctors have been given permanent posts much earlier. But I think things can be better. So this conversion from contract to permanent, what MMA believes, it should be very transparent. It should be by cohorts, and it should be done earlier.
The government is also addressing the shortage in specialists. In Malaysia, there are 2 primary pathways to gain a specialist qualification. First is through a master's program offered by local universities. The 2024 Medical Amendment Bill now allows another route, through a parallel pathway with specialised training conducted by the Ministry of Health.
Because train university hospitals, how many they can train. So that number is finite. And because of that, the Medical Act was changed to overcome that challenge. So the number of people taking a specialisation in Malaysia, I think, has to be increased.
Previously, in cardiothoracic surgery, for example, only 4 specialist qualifications were recognized by the Malaysian Medical Council. 1 qualification from the United States, 1 from the United Kingdom, 1 from Australia, and 1 from Canada. But this has since been changed, so now there are 8 recognized qualifications in cardiothoracic surgery. But more importantly, there is now a mechanism whereby if you're not from one of these 4 countries, there is a way for your qualification to be recognized in cardiothoracic surgery. So this has given the Medical Council some flexibility in specialist training.
Then there is the issue of pay and who will foot the bill.
The number of sick patients coming in keep perpetually going up, and that burdens the whole funding, the national budget and everything.
The question is that where does this money come from? If the government is able to increase the pay for healthcare, basically the doctors or the nurses, that would be wonderful. But of course, the other civil servants would actually want that as well. The teachers, the police, and so forth.
70% of the population in Malaysia is taken care of by the public sector. So you need to have better salaries, better promotion aspects, better allowances.
In 2023, the Ministry of Health published a white paper to address the issues faced by the medical community. One proposal for financing was to increase the fees for those with means, while maintaining low prices for the lower income.
Saya percaya benda ini sedang berlaku dan kerajaan melihat perkara ini dengan serius, namun ia tidak hanya dibiarkan hanya duduk diam. Ada pendekatan yang mereka sedang lakukan. Gaji daripada 3,000 lebih, kerajaan nak naikkan kepada 5,000 lebih untuk lantikan doktor. Jadi ada jalannya, namun ia bukanlah boleh nampak sekelip mata. Ia mengambil sedikit masa untuk dapat kita lihat hasilnya pada selepas ini.
Another solution is to allow doctors in public hospitals to supplement their income through private practice. For example, specialists at the Public University of Malaya Hospital can also practice at the University of Malaya Specialist Centre, the hospital's private wing.
About 300 doctors that we have right now. So they are earning their income under the university and public hospital. So whatever private practices that they're earning from us is entirely their salary. I think the sky is the limit in terms of what the limit of the income that they can enjoy.
But for those who do not wish to juggle public and private duties, there will need to be other solutions.
The government can help to remediate by maybe increasing the on-call allowances, improving the work-life balance, maybe giving more perks and benefits so that they feel better to serve in the government sector. They won't leave. I think it's not something that too much to ask for. It is a fair because they are taking care of life, a lot of responsibilities. I think that's a fair amount.
Kalau kita tengok belanjawan negara untuk dalam KKM adalah kedua tertinggi yang diterima. Tapi ia masih tidak mencukupi kerana kita lihat masih banyak lagi klinik-klinik daif, hospital daif ataupun kekurangan tenaga lantikan tetap dan sebagainya ini yang perlu kita lihat dahulu.
And yet, there are other moves that seem counterintuitive. Specialists now must go through a certification period of 18 months, 3 times the previous duration of 6 months. During this gazettement period, specialists will draw the equivalent of a junior doctor's pay.
Isu ini bukannya isu yang kecil dan bukan isu yang baru. Isu ini isu yang sekian lama bertahun-tahun dari kerajaan-kerajaan sebelum ini dan semestinya ia tidak boleh diselesaikan dalam satu malam. Ia perlu mengambil masa mengambil masa sedikit demi sedikit dan paling penting adalah ada tanggungjawab kerajaan itu nak menyelesaikan. Bukan hanya melepaskan tangan ataupun melepaskan batuk di tepi tangga, tapi ada usaha dan juga komitmen dari kerajaan untuk melakukan perubahan itu.
The issue of doctor shortage is complex and multifaceted. For some, the solution lies in improving the lot of public doctors.
It would include managing the remuneration, welfare of the healthcare workers, also includes the deployment, placement of healthcare doctors across the country, and more that takes care of the healthcare profession as a whole.
For others, the fix could mean improving the health of Malaysians, thus reducing the country's medical burden.
If you take good care at the primary care level, and there are no complications of these diseases, of these non-communicable diseases mainly, like diabetes, hypertension, then you may not need so much of hospitalizations and specialist care.
As for medical student Nur Zulaika, she is staying the course. She's in her final year of her studies and will embark on her housemanship after.
It's first things, it's an honorable job, and even though the circumstances are not great, there is a reason why I'm put into this. There's a reason why everyone is given their own opportunities. So I'm given this opportunity and I can't just throw it away. So I have to take it and use it to my best capabilities. So I do think that I have to be that doctor that I want to be.